KTN News, Nairobi.
Now, following public criticism of the new Social Health Insurance Fund, members of Parliament and Health Cabinet Secretary Deborah Barasa have pledged to work together to ensure the successful registration and implementation of the scheme. This came after Kamkunji, a formal meeting on Tuesday where MPs and CS Barasa met to discuss the progress of the scheme's implementation. However, the Cabinet Secretary was confronted by tough questions about the chaotic transition from the National Hospital Insurance Fund to SHIF and the harsh realities facing the healthcare system at the grassroots level. Here is Daniel Karaoke with more.
After sustained criticism by the public on the new medical scheme, members of Parliament met with officials from the Health Ministry to iron out the issues affecting the scheme.
Fails even more.
MPs raised concerns about the registration process and the scheme's benefit, with focus on its effectiveness and well-being of Kenyans.
So for the elderly people, even when you do the SCAR something, it is not registered, it's giving you an error. And also documentation, Mr. Speaker. When you start registering, they ask either for a marriage certificate, and you know a lot of our people don't have the marriage certificate.
You need merchandise to be able to encourage people asking, why don't we even have a wristband for someone, mimi ni member, nimejisajili for SHA, because it will help. And you can use these members of Parliament and senators to be able to facilitate those CHPs to help in the registration process. And lastly, your systems are extremely slow, and they are going down every now and then.
We are being deducted a lot of money. Could you confirm to this House or to the members here, Madam CS, that cost has now been standardized? That if I do a CT scan at Nairobi Hospital or Mbagathi Hospital, SHA will pay the same amount to both institutions.
Also, the fate of staff under NHIF took center stage. Health CS Deborah Barasa, however, came to the defense of the new health scheme.
Could you please clarify, because you've said they've effectively moved to public service for 6 months. Then what? What happens to them after 6 months, to the employees?
Kuna kitu ambacho hakijafikia wananchi wetu. Ikiwa sahihi wengi hawataka kwenda kujiandikisha, na sababu wanotoa ni kwamba tunatozwa ada fulani, na tunajua wazi kwamba kujiandikisha ni bure. Sisi kama viongozi tuna kibarua kigumu.
Yes, we faced a bit of turbulence and the thick clouds, but we are happy to report that now we are above, and we are really steering and want to ensure and want to assure you, and we are confident that we will reach our destiny of Vision 2030, having affordable, accessible, quality care for all Kenyans.
Speaker of the National Assembly, Moses Wetangula, urged MPs to rally behind the initiative to ensure the smooth implementation of SHIF.
Equally, for the Linda Mama, we see that mothers are covered. It covers only mothers and child for their pregnancy and delivery under NHIF, but under SHA, it covers the whole household.
These are the developments in the ministry in terms of trying to achieve the government commitment to UHC.
The CS has assured both the MPs and the public that the scheme will ultimately be successful, emphasizing the country's sustainable solution in health financing. Daniel.